people that were able to send in some questions beforehand. So we'll definitely start with some of those. And then we will, maybe take some questions at the end. I am really hoping to make sure that I get you guys out of here by about 7 o'clock. And we'll go from there. All right, so this is Multireflexology-Dien. So I think that some of you have taken the course, and then apparently there's some of you that haven't taken the course. Is that correct?
Yes.
Yes.
Okay, so, hi Desiree. So we will do our best to address some things that will help you get started, and also some things that will enhance your abilities as a Dien Chan therapist. So as I'm just kind of playing around with this screen, I hope you guys can all still see my screen. And
Your screen is gone. I can't see your screen anymore.
Okay, let's do this.
Oh, there we go.
Perfect. Okay, so the first question that we're going to get to is basically how do we start using Dien Chan? Some of you are starting as a self-treatment therapy. Some of you are starting by combining it into other treatment modalities. And some of you are looking to treat other people with just Dien Chan. So one of the big questions that I did get is how to start using Dien Chan, or how do I go about thinking that I'm going to be using Dien Chan? And I use Dien Chan specifically in my first thoughts in regards to a diagnostics tool. It's really quick for me to be able to test some points. And can you just see my screen, or can you see my face as well?
I can see both.
You can see both.
I can.
Okay. So I am going to show you what I mean. And I'm sure that some of you will have tools and some of you don't have tools. But just as a refresher, what I would typically do is I would typically use a detector tool. So we have a detector with this smooth sphere. We also have a detector with a yang ball on the other side. And then we also have what's called a comet detector. So you can see that the circumference of these two detectors are a little bit different. The point of the matter is that one is maybe a little less invasive, and the other one is a little bit more to the point, if you will. So I generally start with my smooth sphere detector, especially as a therapist. If you are just starting out, you may be more comfortable with using the comet detector. So starting out, I use it as a diagnostics tool. And if you can see the diagram on the computer screen, this is one of the diagrams that I would go to in order to start working my face. Here we go. Okay, let's see if this is going to let this. Screen. I kind of want to draw on here, so I apologize. Okay, so essentially I'm going to take my detector, and in my diagnostics, or face reading as I would put it, is I start to look at some of the things that I notice about their faces, or about my own face. I'm looking for different types of wrinkles that are showing up. I've got this new little wrinkle that's shown up somewhere in this area, and it has to do a little bit with kidney function. So I would take my detector and I would literally just draw it inside the wrinkle line, looking for tender spots. So this is the Chan beauty aspect, is that I can use those diagnostics like wrinkles and mark. And you might not be able to see it very well, but there's a very faint mark right here that I have on my face. And it's in the lung area. It's actually on the yang lung side. So for me, that's telling me that I have too much heat in my lung area. So what I would do is I would just take my detector tool and I would go into that area of the spot and look for tenderness. And then the rule of thumb is to detect those areas for about 10 to 30 seconds. Likewise, I'm going to do the opposite one to see if there's tenderness in there as well, because again, we're looking for that yin-yang balance in those areas. So some of those types of techniques are going to be how I use them with clients, and how I use them with a self-treatment is I start investigating my own face, seeing if there's no new wrinkles that have shown up or new marks that have shown up, or I also use them specifically for sleep. I use them specifically for more energy and for stress. The top 3 points that I use for stress, and we did go over this in the course, but as a refresher, the points that I use for stress are points 124. Point 124, if you were to divide the forehead up into quadrants, point 124 would be following the tangent in the middle of the forehead in conjunction with the lateral edge of the color or iris of the eye. This is point 124. So specifically, these points generally like to be either detected by a detector, or specifically for stress, they like to have to be detected with the mini hammer, either with what's called the yang side of the mini hammer or the yin side of the mini hammer. At this point, it doesn't necessarily matter. Stress tends to be a yang type of thing, but it depends upon how stress manifests for you. If you're a little bit more recluse or if you're a little bit more overgoing. That's not important at this point in time. It's just whether or not which one feels the best for you, which is what I love about Dien Chan, is that which one ever feels the best for you or for your client is generally the right one. So you would either detect it, and you can see that there's a little bit of a redness that will come up. Generally, if a redness is coming up in that area, it tends to mean that that point needs to be unblocked, or that there's definitely something going on in that area. This point in specifically also is associated with the gallbladder on the upper side of the head. And I know we've talked a little bit about fertility. If someone were to be pregnant, you would make sure that you only detect points above the nose for those people. So you again would either use the detector for that, or you would use the hammer and do 30 times on the 124 plus, which means the yang side, or 124 minus, which means the yin side. And then you would do point 34. Point 34 is essentially located, if you were to find the, I don't know, we don't have a really good word for this, but basically where there's a straight line across where the forehead starts to come into play. It's going to be essentially right above that line, and somewhere in by the iris, or by where the eye starts there. Okay, so that's going to be point 34. You have point 34 plus, which would be this side, and you have point 34 minus. All my points are going red. I must be very stressed out from that lonely meeting. Okay, so those are my favorite stress points that I like to work. I also like to work the bladder meridian, which is point 126. Okay, that really works because the bladder meridian goes from the top of the head all the way down the back and through the hips, down the lower legs, and into the feet. It's a really good way to calm the body. So to get back to that question, that's how I start with Dien Chan. I look for the wrinkles, I look for the marks, I look to see if I either need to do one of three things: decrease stress, increase ability to sleep or relax the person, or increase energy. And we talked about the points that I really like for stress. Other questions that we have talked about are tender points. Okay, so for a little bit of a survey, how many of you have the app on the iPad?
I do.
I do.
Okay. Is there anyone that doesn't necessarily have, yes, Grace.
I have it.
You do?
Yes.
Okay, perfect. That's awesome. So what you see here is essentially the diagrams portion of the app. And the important part to note here is that essentially you can look up a lot of the different apps, sorry. You can look up a lot of the different conditions. And I know somebody was talking about looking up conditions and wanting to look up specific conditions and the protocol that goes with conditions. The problem with that is that Dien Chan is much more symptom-based than it is condition-based. The reason being is because if you were to have a stomach ache, if all of us were to have a stomach ache, the reason why Dave might have a stomach ache or Grace might have a stomach ache or I might have a stomach ache would be maybe different. It all kind of manifests as a stomach ache, but it might be related to stress. Excuse me. It might be related to the food that we eat. It might be related to the weather, or that there's a physical thing going on in there. So there's lots of different things that could be going on as far as that is concerned. So pulling up these diagrams and being able to use this app as more of a research and as a way to build bridges between the different types of conditions. And I'm going to give you an example. Excuse me. I'm going to give you an example. I had a client come in with severely dry eyes. She's been to the ophthalmologist a lot. She has drops that she needs to use all of the time. And so I pull up the protocol for dry eyes, or I select the head, I pick eyes, and one of the symptoms next to it is dry. So I started by testing each of these points. So you'll notice that as you pick or as you pull up the app, that you will see black numbers and you will see red numbers. That isn't necessarily very important until you start past module 3 and you become able to, and we will cover it maybe in another webinar, but when you start creating formulas for your clients. But what's important to do here is to record the findings of which points on your client are the most tender. So you need to be able to record those findings. And in those areas that you find that are tender, you need to be able to see whether or not there's a spot or a mark or a congestion, like a muscle that's tight or tender, or whatever else is going on in that area. Maybe there's dry skin. Maybe there's a small patch of eczema or psoriasis or something along those lines. Maybe there's even a little bit of a divot or a puffiness. something along those lines in those tender areas. So you need to record the findings that you have. Not all points, sometimes all points are going to be tender, but in this case that I was working with the lady with dry eyes, it started to become a little bit more apparent that it was the gallbladder points that were more tender for her than some of the other points, like lung or small intestines or whatever else that came up in regards to traditional Chinese medicine types of diagnostics. So I started to look up things like gallbladder meridian through some of my other techniques and foot reflexology. I was testing certain things. So that's another thing that I really like about Dien Chan is it's an immediate way to test my diagnostics. So I might think there's something going on inside of the body, but I need to be able to test it and verify it very quickly. And Dien Chan allows me to do that. So with this client, I was testing those points and found that her gallbladder meridian, which gallbladder governs the eyes, liver and gallbladder govern the eyes, and it was essentially that wasn't working very well. So I went into the app and I looked up the gallbladder meridian points, and along with that I worked the gallbladder meridian throughout the whole entire body, but it was the answer that was able to deal with her dry eyes. And even to this day, which is probably only 3 treatments later, and we're going on probably 6 months, she still doesn't have to use drops, and she has been referring people to me for their dry eyes. So if you find a tender spot, make sure you record those findings, and then you're able to send your client something that is able to, they can either use their hand to massage those points, they can purchase a tool from you. There's lots of options that they can do for those types of things. It's something that you could do for yourself as well when you start looking for wrinkles or marks or those types of things, to be able to look into for points that you can detect and for bridges that you can make. Does that make sense?
Mm-hmm. Yes.
Okay.
Right there, like, even when they go like this, I don't know why.
Sorry, I can't hear you very well. Did somebody have a question? No? Okay. You're more than welcome to, if you have that chat, to be able to write down any questions when you think of them, and then I can make sure that I address them as we go along. So you also want to manage congested areas. So one of the best ways as well is to actually touch the face. So as part of the diagnostics technique, you want to go in and test for certain areas. Typically, areas that will feel congested are in through the lung areas, which are essentially just right on that orbit bone or on the lower half of the orbit bone. The liver and gallbladder can feel tight and congested, and essentially the way that that feels is there's some muscle tension in that area. I'm sure all of us have had tense muscles before, and so we kind of know what those look like and feel like. Other areas can be the spleen. Any area can generally be congested and worked out. So as a self-treatment, definitely you want to be looking for those congested areas on your face where you can feel that there's some muscle tenderness. How you can work them out. One of my favorite tools to work out congested areas is by this tool here, the small brush. You essentially just use it to press in and do a little bit of massaging like this. It really helps to get out the congested areas. My other favorite tool for that is definitely the little hammer. So going in while I'm watching a show is typically when I'm doing it, but I've also gotten into the habit of doing it while I'm in the bath, which is quite enjoyable. All right. So that's how you want to do self-treatment as well. So when you're doing the treatments for other people of how you get started and where to go to from there is you test those points or those tender points at the beginning, and then you would retest them at the end to see the difference of improvement. So you can either start this with a pain scale. So maybe at the beginning, those tender points on a scale of 1 to 10 is somewhere around the 8. You want to record what the tenderness level is going to be at the end of your treatment. The reason why you would want to do this, especially for a therapist, is that now you have quantitative data that you can tell your clients. This is really good. We got about an 80% improvement rate in the liver area, or perhaps maybe the adrenals didn't respond as much as we would have liked them to. It gives a very diagnostical way for the client to be able to know what's going on inside of their own health. The way that we can do that is by giving them as much value and as much quantitative data, because unfortunately we're kind of in that realm where not a lot of people are aware of changes immediately in their own bodies. So that's definitely one way that you can do it, is you test and then you retest. So when it comes to self-treatment as well, because we look at things of when we're using the tools of how they feel on our face, lots of times I know I'm a liver girl. I know that whenever I'm going to go into my liver point or my liver zone, that it's probably going to be tender. So it's at that point that I will get out and use different tools, whether or not I like the other end of the comet detector, and I start working with it that way. That feels good for a little bit. Whether or not I want to come in there and work with the yin roller. I generally have a little bit of a hot liver, so I like the yin stuff the most. So whether or not I sit there and use it like this, I tend to be a little bit more, because of my personal life, I tend to like the mini hammer a little bit more. For me, it feels the best on that area. Okay, so just test and try different tools, see which ones you like. It might be great for 1 minute, it might be great for 2 minutes, but just try out different tools. This is also a good way to know which tools you're going to want to use on your clients as well, if you have felt them yourself. It's always best to guide someone to go somewhere if you've already used them on your own face. All right, so this is sort of the webinar Q&A. One of the topics that was brought up was the fertility. So fertility is definitely a few-fold. It depends upon the reasons why they're not fertile. So typically what we would work with is fertility that is unexplained, or what they would say, yes, unexplained fertility. So what we need to do is we first need to make sure that the environment for the body is in a non-acidic state. So we need to do some points or some protocols to make sure that the body is not in an acidic state. There is a non-acid point, which is around the nose area here. And I don't know if anybody has their tools with them right now, but right around the nostril area, you're sure to come around, and maybe half of you, there will be a point about halfway down your nostril area that will feel tender. This is the anti-acid point in the body, or a point in the body that we would say more so reduces or balances the pH level. It's on both sides of your nose. Your noses, both sides of your noses. Both sides of the nose in about the same area. Okay. All right, All right. So the other thing about fertility is that you need to make sure that the hormones are balanced. There is an amazing protocol inside the app that is responsible for balancing the hormones. But point 26, if we're not dealing with somebody who has low blood pressure, point 26 is really good for balancing in through the pituitary, which is the master gland, and helps with all of that. Then in points around in the adrenal area, which is point 17 on both sides, are really good. And of course, some of the other points, and I'm not going to get too specific into those, but you can definitely look at them in the app and follow the hormone rebalancing app. If you're working with somebody, it is definitely ideal if they are to perform self-treatment on a regular basis. And so whether or not that's that they get a tool, or whether or not you teach them the morning massage of rubbing the uterus and rubbing around in through the ovaries 50 times. If you don't have access to the morning massages, you're more than welcome to send me a note and I can forward you on to those videos. So we want to decrease the acidity, especially in the uterus area. Then you want to balance their hormones, and then you want to make sure that they're sleeping properly. And ideally between the hours of 10 and 2 a.m. is the best time for sleep and recovery and repair. So that is the best way with Dien Chan to be able to help somebody with their fertility. There is also a fertility protocol within inside of the app. It's pretty good. Again, you would pull that up and you would test the points and you would record the findings, and then you would either require that person to do a daily 5-minute routine in order to balance those points, or they would come back for repeat treatments, probably on a weekly basis for about 6 weeks. Also depends on whether or not they're having any other fertility treatments as well. There is definitely a nutrition component to fertility. There are other components when it comes to fertility, but that is specific to Dien Chan. We talked a little bit about dry eyes and looking to see whether or not the liver or the gallbladder has anything to do with dry eyes. So again, using the app as a way to make inferences and to build bridges. So looking at, once you have recorded all of the points, see if there's any commonalities of the points that are tender. And if you see, you know, and maybe they have a few different conditions. So in this case, there was dry eyes and there was heartburn and some other types of conditions. So you look up all of those conditions and see what are the common denominators. And those are the ones that you start to think about as far as having some issues and needing to be unblocked. If you're having trouble between, you know, some are yin and some are yang and there's no rhyme or reason to what's going on, it's at that point you would either look up in the textbook. The textbook I think has the best protocol for this. But you would do the triple warmer, triple heater meridian balancing, which basically means it's going to try and bring that yin-yang balance into between external and internal temperature. It's going to bring that back into balance. And then perhaps they will manifest, or the points will be a little bit more true to what's going on inside of the body. Does anybody have any questions in regards to what I've just said for that?
No, thanks.
Seem to be okay. All right. So, Okay. We've also had cellulite come up as a question. Cellulite is an interesting thing because essentially what's happening is that the cellulite is becoming a little bit hard, and cellulite can manifest in different ways on different bodies and in different places. But essentially what we want to prevent is the cellulite from getting so hard that now it's interfering with nerve conduction, it's interfering with muscle movement, and it's probably also interfering with circulation and other types of things. So the areas of cellulite can actually cause toxins to be held in the body for a really long time, and it can also stop the flow with a lot of different things. The best way to deal with cellulite, I don't have the tool on me right now, but it is the triple yang roller, and I'll just go for 2 seconds here. This is the triple yang roller. The reason why you would use yang to begin with on the cellulite area is because it increases flow, it brings circulation to that area, and in order to really break up anything of that sort, you need more hydration, you need more blood flow, and that is what's going to help start taking away the toxins, is the blood, because it will start to go into the lymphatic system. So if you haven't taken the Chan Beauty, we do learn a cellulite lymphatic protocol for the whole body in there, and it's extremely effective for getting things really going and really moving. So you would first start with the triple yang. Then you would move on to a yin type of technique because we want to drain it and disperse it after that. So once we have brought up all of the circulation, all of the nutrients, we've gotten a good energy and a good flow going on, we want to disperse it and we want to move it and we want to drain it. So that's essentially why you would do the yang-yin protocol on the cellulite in the local area. If you're wanting to reinforce it, you would want to make sure you do so with what's called the hepatic zone, which includes the liver, the gallbladder, and what's called the fat burner point, which is 233. If you have the detector tool, the nice part about it is on the other end, you see that there are 3 points. In the textbook and in different diagrams, you will see that there is a little bit of a triangle. It means that those points have or play a role in each other. So what you can do is you can actually place this tool directly onto the liver, the gallbladder, and point 233 all at one time. This is going to be a good way to get things moving, just as a shorthand technique of working with that area. Of course, if you're dealing with the legs, as you've seen in some of the diagrams, the legs are around in this area. So if it's specific in that area, I would use the small brush and I would work in that area with this tool. Would be my favorite tool to use. Okay, and then I can bring it around and drain it out the bladder. Okay, and I would do that for both sides. All right, so for cancer. Cancer is an interesting topic that comes up. And everybody who is going through cancer will manifest symptoms differently. The best way to support someone doing cancer is, or doing treatments for cancer, or someone who is getting through or working with this, is to support them symptom-based. So whether or not it's dry mouth, whether or not it's fatigue, whether or not it's pain in a certain area, or whatever it is that they're dealing with. Maybe it's emotional type of stuff that they're dealing with. So I would rank whatever it is that they're working on or their symptoms of their condition. I would work to support those. One from the one that is the biggest priority, and I would move that down and I would work it symptom-based, moving along with that. In addition to, I would make sure that I work point number 1. Point number 1, it's a small technique. It doesn't always work, but this is kind of a little bit of a good technique, is you can push the nose up a little bit, and you can see where it starts to bend right here. You're gonna find a point right in there that's probably extremely tender, and that's point number 1, okay? The other point that you can work is point 300 plus. So point 300 plus is going to be on the right side of the face for the yang side of the face. And the reason why we're gonna work this one is because we want to increase the qi. When the qi of the body is increased, it gives their body the ability to handle things a lot better. We don't want to increase it too much. We don't want to overdo things as well when we're working with people who have strong types of conditions going on, but we want to do a little bit of stimulation. So even though my favorite tool is definitely this detector, I would be more inclined to work the area with the Comet detector, just as a little bit of a stimulation. So just like we worked point 124, which is over here, your point 300 plus, again, if we divide the forehead in through here, I'm gonna take the middle, and then I'm also gonna take the middle again in the top half, and then I'm gonna be looking for the point that is on the inside of the tangent or the color there, and I'm going to look to hold it here. If they are in a very strong state or a fragile state, you may want to look at just using the salon pass as a way to stimulate some of those points. So put on some salon pass to those points without even detecting them. It's a small, subtle way to be able to work some of those points. That also brings into the fact that we're working with blood and increasing the integrity of blood. And one of the best ways to do that, again, is through point number 1, which is the bone marrow point. It is a point that is able to help feed the whole body with good nourishment and make sure that there is good integrity inside of the body. We have talked a little bit about heartburn, but I had a client even today that we were dealing with heartburn. And I'm not sure if anyone is familiar with what the causes of heartburn are, but essentially for a long time the medical profession has put the clients or the patients with heartburn onto PPIs, which essentially are your antacids. The trouble with this is that there's a huge line of long history, a long list of side effects that go along with these, but it also reduces the acid. So it doesn't necessarily fix the problem. It just means that you're not feeling the acid that's still leaking into the esophageal area or even down and through to the duodenum area, affecting the small intestine, and which is definitely going to affect and hinder your ability to assimilate nutrients. So one of the best ways that you can deal with heartburn is obviously through working the stomach point or working in through the stomach area. You will see on the diagram that the stomach area is a big zone. So you can, like I said before, manage that area of congestion. So lots of times that whole area will be congested. Yes, we have a stomach point, which is point 39, and it works really effective to work with that. But you can definitely use this tool to work that entire zone, finding the different areas that are the most tender and keep working on them. Again, looking up into the app to find out the protocols or the points that are effective for working gas, bloating, and heartburn. Lots of times your gas and bloating is because of an irritation in the large intestines and the small intestines. So even going into work those types of points. So point 38 and point 127. Again, it's going to depend upon if that person is more likely to be on the constipation end versus the diarrhea end. Those types of things are going to let us know whether or not there's a yang in the body, too much heat, it's burning, makes everything liquefy, or if we have a cold in the body, and just like our intestines, when we're cold, we get a little bit shut down and things don't work as well, so we need to provide some heat. So again, that's why the app is the way that it is to make sure that we're working symptom-based, and it allows us to build some bridges. Some other things that I've been asked to make sure that I cover in this are what my favorite tools are. We've gone over some of them already. Definitely my favorite tool and my go-to is the detector with the smooth sphere. I really like that I can go into points and then afterwards turn it around immediately and give myself a little bit of a massage. So that's probably the reason why I like this tool the most, is because I can really get into, especially after a day of sitting and treating people all day, is that I get to essentially go in and work this area. I also really like the detector with the yang ball on the other side, because then I can turn it around immediately and give myself a little bit of a massage that way. So those are probably my go-tos, but this one is my go-to as well, first. Then my other favorite one is probably the small brush. The reason why I like this tool is because it's very versatile and can be used for a lot of different things. I can use it as a somewhat detector. So if you're into selling these things to your clients, it also is a little bit less intimidating for people to be able to use, because it's somewhat of a detector. You've got lots of detectors on there, but I don't have to worry about whether or not I'm on a specific point, or whether or not I'm doing things right, or whatever the case may be. I can just press and hold into areas that I find tender. Press and hold them, then I can massage them like this, and I'm just going gently over the area in order to drain them. So this tool is very versatile, meaning you can use it in a yang way, which means you're pressing and holding into the different areas, or you're doing little circles, which would be more so in a yin type of way. The reason why I like this one is because then I can iron out my wrinkles. It's probably my favorite thing to do with that, because I'm on a quest to get rid of my crow's feet. Okay, so those are probably my two top favorite tools. My other one is definitely the mini double yin. The reason why I like this one is because I frequently get dry lips, and I don't know if any of you saw my very amateur video that I just did, but I really like to roll this over my lips. It immediately gives me a soothing feeling, and it's very good for calming down issues in the stomach. It's good for calming down the heat and the fire in the body, bringing you back to cancer. Generally, people who have attracted cancer, their cells are generally of a higher pH level, higher acidities, and we want to calm those types of things. So I think we were talking about lung cancer, or somebody had brought up lung cancer. So basically in the areas of the lungs, which would be in this area, you would just work to, and of course you want to first determine, you know, is there congestion in the yang area or congestion in the yin area? But generally, because this is a calming, dispersing type of effect, they will generally like the double mini yin, okay? And you just roll over it. There isn't any perfect answer as far as how long you're going to do it. Generally, you're gonna know whether or not that person wants you to continue going on or not. But general rule of thumb is about 2 to 5 minutes in the area that you're working. If you're obviously doing it yourself, you're going to know when you want to stop and when you don't want to stop. So if it feels really good and it's like getting that itch that you really want to get, then keep doing it. There's no right or wrong way to necessarily do this. And I know that that's somewhat of a challenge when it comes to Dien Chan, but it's also an amazing benefit of Dien Chan as well. All right. We have a comment from, there you go. So for kids, the brush and the roller, she calls the tantrum tamer. It is amazing for that as well, for calming children down. The other one that I really like for calming children down is the rake. For some reason, the kids just love the rake. And what you do to calm down the children is you take the rake, and you can do this as well for your own mind and stress, is on the right side, or the yang side, the one that keeps us up and the one that wants to keep thinking. We take the rake, and just on the right side is we rake down. It's amazing for children. It's amazing for calming down the brain and resetting those cranial nerves. Okay? Okay. How to better use the tools I have. Just as a quick show of hands, or if anybody has questions as far as the tools that they have and they don't necessarily know how to use them, please let me know right now if there's any tools that you have that you are not quite sure of how to use them. And I've unmuted all of your microphones, so you'd be more than welcome to just speak to the group to ask if you have any questions, or to let us know if you have any questions about the tools.
I think one of the questions that I have, Erica, is on the beauty brush. When a person's doing the facial treatments, where do you use it on the face to move it most effectively for the lymph fluid?
So you're talking about the beauty pad or the small brush?
The pad. The pad?
The pad.
Yeah.
Okay, so this tool here.
Correct.
And so your question is to know how to use it in a lymph type of way?
Correct. When you're doing the facial treatments for the beauty pan, which way would you move the brush over the face the most effective to move the lymph fluid?
If we're talking about doing like the lymphatic drainage protocol on the face, I definitely, this is probably not the tool that I would use.
Okay.
So I would do probably my beauty treatment first. So the one treatment that I do with this is obviously the full face massage.
Okay.
And then the tool that I would use to follow up with that would either be my comet detector in doing the lymphatic drainage protocol. But essentially what the idea is behind the reflex drainage is to make sure that the person afterwards is going to go pee, because the lymph is actually, it re-enters into the bloodstream. So we want to make sure that the kidneys can filter it properly, and then of course it comes out in the form of pee. So the reason why we do the lymphatic drainage protocol starting up here, which is the armpit and the groin area, down the back and the chest for those areas, and then around the groin area for the groin lymph, down the legs and out through here, is because again, this area is the bladder. So that's, if I were doing a facial treatment, I would first do either my yang yin balancing, and then I would do my facial treatment. I would do my therapeutic part. I would do the massage, and then I would finish off with the lymphatic drainage protocol. And my go-to tool is definitely the comet detector for that. And I will sometimes use the small brush for that, again, depending upon that client's specific needs. Does that answer your question, Cindy?
Yes, it does. Thank you.
Okay.
Erica,
Yes.
this is Grace. I wanted to know for under eye bag.
So under eye bag. So in Dien Chan, and hi Grace, it's nice to meet you over the internet here.
How are you?
For eye bags, there's a couple of things going on. Generally, the body is holding on to too much sodium in the kidneys. So one of the primary functions of the kidneys is to reabsorb water and electrolytes. So when we have bags under the eyes, it's generally because there's too much salt in the body. So we first want to support the urinary system. So we want to support the kidneys, and we want to support the drainage through there. One of the diagrams, it doesn't really show it in the book very well, but there's little kidneys right here, and then the ureters come down and the bladder's right here. So that is a micro diagram within the big diagram, which basically would say that these are the kidneys, and then the ureters come down here and empty out through the bladder. So we definitely want to support those areas and functions with that. And then on top of that, what you would do, and the popular tool for working with bags underneath the eyes, is the concave roller. And it's mostly because of this smooth brass part of the tool. So again, you could use this one here end, or this one here end. But basically what you're wanting to do is you're wanting to, again, drain the kidneys out. So one thing that I really like is obviously coming really nice under the eye in one solid motion. So we're not going back and forth like so, because the purpose is to drain. So you can either drain and bring it outside like so, or if you remember, we have a specific kidney point right here. So what I have started to do actually is to bring this out like so and drain it out that way. So the reason why I do that as well is because I'm draining the local area. I'm bringing it again past the kidney point, but also if you remember the Penfield diagram, the throat area is right here. So I'm also now draining it out this area, and then I'm draining it out locally. So that's one technique that I have definitely started to do when it comes to bags, but you will want to make sure that you support the kidneys with its electrolyte balance.
Okay, thank you. Will you be recording your classes in Calgary?
The actual courses, like the certification courses?
Yes, yes.
We will not probably be recording those. There will be some things that we will definitely be recording as far as protocols that we do for people. I know one of the major requests is to have a video of the lymphatic drainage or the cellulite protocol. So I know that that's definitely a priority, and we'll be working to make sure that that's available.
Okay, sounds good.
Yeah, was there something in specific that you were wanting to make sure that you had recorded? I'll just make
I can't get to any hands-on classes, so I'm trying to figure out how to get exposed to it more.
Okay, and where are you located?
I'm in Anaheim, California.
Okay, so
I missed San Francisco. I just missed it.
Darn.
Yeah, I wasn't familiar with this therapy then.
That's quite all right. So we've just actually started to go into the United States, and we will definitely be coming back to the United States We're going to be in Las Vegas in June at the aesthetics trade show down there. And then we do have a plan to host something in the fall in that western region. So
Okay.
we definitely keep you apprised to that.
Yes, Michael does a good job of that. Please thank him for me.
Yes, I will. He is quite amazing when it comes to that. Better than me, so it's great that I have a good partner. Okay, excellent. Any other questions that you guys might have? We're definitely coming, or we're over time now. So if there are any further questions, we will end for today.
That was great, Erica. Thank you very much.
Yeah,
Thanks, Erica.
I hope everybody was able to take away with something and learn something that they didn't already know. And if, of course, if there is something that sparked your interest from this, or that you found intriguing, or that I didn't elaborate on, we will be hosting more webinars to get a little bit more in depth and more in detail. So we just wanted to make sure that we had a little bit of a Q&A and to kind of show you a little bit about what's going on. So just a quick question here. We have the letting you know that Patrick will be coming back. So if you haven't taken any of the modules, I will be teaching Module 1 and Chan Beauty in Calgary at the end of March. Patrick will be coming and teaching modules 2 and 3 in Calgary May 29th through June 1st. We'll be going out to Vancouver to do modules 1, 2, and 3 about, I'm going to get my dates wrong, I apologize, but it's around June 10th through the 17th. So one question is, what to expect in level 2. So on the screen here, you can see that the first poster that we have is the Dien Chan diagrams. In module 1, we go a lot, we stick primarily to the diagrams and learning how to reflect these diagrams onto people's faces in order to get the diagnostics. And then when we move into second module is when we start dealing with the actual map of the face and learning the different points and what they do and why you're going to work them. Module 3 is when we start getting into how do we figure out why we're working these points? What is it? What is the effect that we're trying to get? What is it that we're trying to promote in the body? And I know if you've taken modules 1, 2, and 3 kind of right in a row, a lot of that stuff has probably slipped your mind. And there's a lot of information to go over with all of this. So if you do have any questions or need some refreshers about that, by any regards, let me know. We'll also be making sure that we come up with a little bit of a landmarking type of tool. For example, point 61, if you look at that third poster, it's on the nose, kind of right as the nostril comes up. That can be very deceiving because that's not where point 61 is located at all on the face. So it can be challenging for some of the points. So module 2 is very focused on really learning how to landmark the points and knowing what they are and why you're working them. And so I think that's about it for now. Any last questions that anyone has? All right. Well, I guess that's it for now. We didn't get any further questions, I don't think. All right. Well, thank you guys all so much for attending the webinar. And again, I hope you got some positive information out of it. Of course, always send me an email or Michael an email. My email, or you can always send it to Dien Chan, so DIENCHAN at reflexexp.com. So that is reflexexp.com. And we can make sure that we address any questions that you might have. All right. Well,
Thank you.
yes, everybody have a really good night.
Take care.
Nice
Thanks so
meeting
much,
you.
Erica.
Thank you.
Yes,
Bye.
absolutely. Take care. Good night, guys.
You too. Bye.
So I did record it. Oh, okay. 54 minutes. So I'll just, I think I can just, send it to you. Sure.